Our next key into becoming a master Damon finisher has to do with bracket positioning for smile arc and good occlusion. Along with this also has to do with our next topic, which is enamel recontouring before and after treatment. But we're going to talk mostly about enamel recontouring before we place a bracket. So these two kind of go hand in hand. So bracket position or bracket placement, really, in my opinion, this is the key to all of finishing, is getting the brackets in the right spot. And it really is an art form. This precision bracket placement is key in getting your good finishes, and I would have to say it's your number one key out of all of the keys of finishing, is getting your brackets in the right spot. Your cases will finish beautifully, your occlusions will be spot on, and you'll have those most beautiful finishes you ever could imagine. And when we do this, we have to remember that bracket placement is so important that for about the past 10 years I've been teaching this, and I think as you focus on your bracket placement, you'll get better. And it really is the most important aspect of finishing. I want to show you this gentleman here. This is Ken, and Ken has been in braces for the second time. He is about to have a 2-jaw surgery because Ken is in a lot of pain. And he's had some TMJ problems before, but he's in a lot of pain. And this is, you can see this is his center picture. Ken is in so much pain that he has talked an oral surgeon into doing 2 jaws to help him. His orthodontist has kind of lost control of the case and control of Ken's well-being. He is in severe pain in his jaws, and he's seeking a solution with a 2-jaw surgery. He goes to my twin brother Steve for a root canal, and he is telling my twin brother Steve that he's about to have this 2-jaw surgery, and he wanted to get just one more opinion from another orthodontist. And my twin brother said, hey, you need to go see my brother Stuart. So this is how Ken shows up to my office, and first glance you can see that things are not under control and the hygiene is poor. He's been in treatment this time for 26 months. Now, he comes to me for a third opinion, and this is what I see. You can see that class 1 on the right, slight class 2 on the left, open bite, and there's a lot of steps in the wire, and Ken is in pain. So much pain that he's seeking out treatment to do something very invasive to get himself out of pain. Now, I want you to be asking yourself, what would you do, or how would you treat Ken? Would you send him on his way and let him have his 2-jaw surgery? Are you going to put some effort and some thought into this as to why he's in pain? And can you help him get out of pain without the 2-jaw surgery? That's really the key here, is helping him so that he doesn't have to go through an invasive procedure like 2-jaw surgery. Overall, the arches look to be pretty well broadened out, and things seem to be in fairly good alignment this way. But it's that occlusion that's the problem. Now, I told Ken, I said, Ken, I'm looking at this and I can see some issues. I feel like this is just a bracket placement problem, and I feel like that if you would let me take these braces off, I'll put the Damon braces on, and by getting the brackets in the right spot, I feel like that you would be out of pain. And he said, you mean you're going to do this, and you think you can do this without having me have a jaw surgery? And I said, you know what, I can do this without having you get a jaw surgery. I think your pain will be gone and you'll be in great shape. And he said, let's go. So I stripped off the old hardware and put on the Damon system. And this is going to show you, this next slide shows you at 10 months into treatment what's going on. Now, for 10 months now, I've put brackets on, and I have great bracket placement, great torque control, because you can see on the left there, the torque is out of control. He's been out of pain the entire time since I've changed the brackets out. There's been no elastic wear, and obviously his midline's still just a little bit off. However, If you look at him, he is a happy camper now. We took his braces off shortly thereafter, but I want you to see what's we've got here now. You can see that we've got some bone loss, some tissue loss, but this is from 2 years of destructive heavy force orthodontics. And for me to come in and just clean things up, this is the day we took the braces off, but look at the occlusion, very stable. He still is in no pain. He's in great shape. Look at the occlusion there. This was just bracket position problem that was causing flaring of the teeth and for him not to be stable. Completely out of pain, no problems. I've checked his occlusion. He's in great shape. This is the power of placing the brackets in the right position. You can see how beautiful and wide the arches are, but he's a happy camper. No jaw surgery, in great shape. I hear this all the time. I hear doctors telling me they can't finish with the Damon system. And you know my reply to somebody, if they tell me they can't finish with the Damon system, then I will tell them they can't finish with any system. They probably ought to just go see Sure Smile and help themselves out, because finishing with the Damon system, number one is bracket placement, number two is torque control. And if you're not good at either of those two, placing brackets or picking out correct torques, then you're going to have trouble finishing with the Damon system as well as any system. And I say that with all sincerity of heart, not in a manner of trying to say that people are less than. The single most common reason for mediocre finishing is incorrect bracket placement at the initial bonding. Now, we always do a panel reposition visit to catch our mistakes in bracket placement because nobody's perfect at placing brackets. But this really is the key in finishing. Why is this? Let me show you a case that a good friend of mine sent to me for an evaluation. He did a great job with this case. Alan Tagg. And Alan is an orthodontist that's been doing the Damon system, and he's using the system here on this very tough case. Posterior right crossbite, severe crowding, and this patient's been in treatment for quite some time, for about 2 years. And Alan sends me this progress update of this case and says that he's having a tough time finishing. He wanted to know if I would take a look and see where he's at now. You can see we've got some crossbite buttons. Looks like we're in stainless steel. There's a few bends in the stainless steel. There's some Kobayashi ties in the front for elastics. And overall, the case has been managed excellent. It's just a few little tweaks here that's going to get this case finished up. So if you look closely, this is just a bracket placement error. The upper left 4 needs to come down. And the upper left 6, it looks like the bracket's very occlusal. And I think that this is just preventing this case from settling into place. If you look at the other side, all the way from the 4, 5, and 6 on the upper needs to have the brackets repositioned, and you can see that we're still in a little bit of a crossbite there. It almost looks like the wire on the top also needs to be expanded to help get out of crossbite. So 2 years into treatment, this is what the patient looks like, and you can see that we've got some torque bends, we've got some buttons on there, and I think that this case just needs to be broadened out and have a few brackets replaced. So I sent this letter to Alan. I said, great to hear from you. I hope all is well. This is a great case, and I see where you're about finished. My opinion is that we still have a few bracket position issues. I'd rebond the upper right 4, 5, and 6, position them more gingivally to bring the occlusion together. I'd also rebond the upper left 4, bring the whole tooth down more occlusal. The molars look like they are very occlusal. If you replace them more gingival, that should help it come buckle. I would widen the top wire, narrow the lower wire, especially in the 6, 7 area. I'd also place one more button on the upper right 7 and run crossbite elastics. Hope this helps. Great job. So this is 5 months later. Alan sends me these pictures of what he followed what I recommended. And if you look closely here he was in 2 years. And then by repositioning, this is 5 months later. Now this isn't a long time. Reposition the 4 and the 5. Look at where the molar is. It's in great spot. look at the other side. Just by repositioning brackets, this case is finished. Now, this really, is a segue into asking yourselves the question, how were you taught to put the brackets on? So I'm going to share with you what some of my bonding protocols were, and talk to you about how I've changed that to have beautiful finishes like this one Alan just finished. And this is what I was taught back in 2000, even in residency in 1998. And I was taught to place the 1s at 5, the 4s at, or the 2s at 4.5, the 3s at 5, and so on. And that would give us that nice little wedge. What I found is that most of the time when I position my brackets this way, this is all that I did. I just created a flat smile arc. And although I had good occlusions, the aesthetics part of my cases weren't finished that well, especially in the smile arc. So I went on a journey to try to figure out what was going on, and I realized that when you position this way, you get a very small wedge, if not a reverse wedge, and it's flat and it doesn't look that beautiful. So what is going on here? And I think that through the years, orthodontists have been placing brackets more incisal to make it easier on themselves. And especially in the anterior, when you place the brackets more incisal, then you tend to end up with reverse smiles or flat smile arcs like this gentleman. And it's interesting because I have seen that more than ever before in the area that I'm practicing, the smiles are getting flatter, and that artistry of the smile, that artistry we talked about, that having vision and finishing well, is gone. So what is it going to take for us to bring this artistry back? And I think that it really is all about bracket positioning for the beautiful smile. So we call that smile arc, and I know many of us are concerned about this. And if you think of it this way, I think it makes it very simple. We're in the business of creating a smile arc or enhancing the smile of our patient's smile arc. So if you think of it those two ways, we're either creating one or enhancing one, then we're going to be on with these beautiful finishes. So it was interesting. I remember seeing Faith Hill a few years back, and Faith Hill was standing on the stage singing a song, and she made a big splash at the Grammys or wherever she was, country music festival or some big event. And I remember seeing the brackets on there, and then I got this close-up photo, and I realized that, whoever placed the brackets in this case really wasn't placing for smile arc, because you can see this wire bending down, and that's going to flatten the smile arc. So in a case like this, I'm sure that they had to do a major reset on those brackets so that we wouldn't flatten Faith Hill's smile. It really is about bracket positioning in the anterior. Now, this is not what I'm referring to for smile arc, because yes, you can position the brackets very gingival, so gingival that you put them up closer to the CJ and you can still get a smile arc. But this is not what we're referring to, and this is not a case where, I'm not sure, I think I found this on the internet, but we want to avoid placing the brackets so high. Now, my goal is to show 100% of the incisors when finished, and that way we have these beautiful smiles for patients as they age. Anybody can put a bracket on a tooth, but can you get the results? This was another case that I found that the brackets are very, very gingival, and it's got a nice smile arc, but I personally don't think that we need to place the brackets up so high to get that beautiful smile arc. Now, our goals in placing brackets for the aging smile really has to do with creating a beautiful smile for the 14-year-old, not for the 40-year-old. So we want to anticipate the aging process and realize that as we get older, we show less on our smile, and our lips will tend to drape and droop slightly. And so we want to create those youthful smiles that will last a lifetime and really stand the test of the aging process. And I appreciate Dr. Sarver and all that he has done for our profession. So when we talk about Smile Arc, that's created by making a wedge. And for the posterior, we're creating this nice wedge from the posterior to the anterior, but we don't want this wedge to get out of whack, meaning that we don't want it to be too big. For a while, there's some, even myself included, were placing the brackets so high that the wedge became so big that we had problems getting our cases to finish well. Now, I've made this graphic really simple. If you want a Smile Arc, you need to place the upper ones 1 to 1.5 more gingival than the cuspids, and the laterals 0.5 millimeter more gingival than the cuspids. That's how you're going to create a beautiful Smile Arc, and you can exaggerate those placements in the anterior according to what you need for Smile Arc. Now, this is Dr. Nasib Balut, who has provided me this slide. I think it's wonderful. This is showing a patient that, if you look in the right-hand corner, if they're only showing 3/4 of their upper incisors, with the lips at full smile, then you will need a little bit more incisor show, so you would place the brackets a little bit more gingival according to the cuspid. Now, you can see here if the cuspid's at 5, the centrals would be at 6, and the lateral at 5.5. Here's another situation that Dr. Nasib Balut is showing, and he's showing that a patient like this is showing who is smiling 100% of the incisors show that maybe we don't have to place the bracket so gingival. In this case, he's showing the cuspid being at 4, and then the central at 5, and 4.5 for the lateral. Now, this is the principle I want you to understand, is that as long as your central incisor is more gingival to the cuspid, that you're going to have a Smile Arc. This is an example of a case that was treated up at the school at University of Pacific, and I worked on this case with Dr. Tom Pitts and some of the residents, but you can see that we've placed brackets for Smile Arc in this case. This girl on the left was already out of braces once, and her mom was a dentist, didn't really like the smile, brought her into the school, and this is what was created with good bracket placement for Smile Arc, and you can see the arch width, and it's just beautiful. I will say this, that the brackets are getting smaller. We're getting harder to see the intricacies of the doors that are opening and closing. And if you're not using loupes, then I'm telling you that you're missing out. I use Oroscoptics, and I think they make some of the best loupes that are on the market today. And this is just something that you absolutely have to put into your practice life. I think it makes a huge difference. So we've talked about bracket position. I'll talk a little bit more about that in a second. But before we do, I want to talk for just a second about enamel recontouring. If you're going to recontour teeth, I think the number one tooth that you need to recontour prior to placing a bracket is the cuspid. There's not a lot of other teeth that I'll recontour or adjust before I place brackets, but the cuspid is one is if we don't have the cuspid recontoured in the right shape and morphology, placing the brackets is not really going to help us. So we want to do some recontouring before we place that bracket. Now I'm going to show you here a little video that shows how I recontour. Now when I'm recontouring, I'll go ahead and use a football diamond, and I like the red stripe. It's a fine diamond, and what that will do is that'll allow us to have the nicest recontouring without creating too much friction between the burr and the tooth and creating sensitivity. I like to do this before, if I can, before I place a bracket, so I get the bracket in the right spot. So this is an example of how I do this. Now what I'm going to do is, I'm going to turn this down here. What I'll do in this situation is I'll run this slow speed. I try to run the slow speed as much of a stall out speed as I can. And if you'll notice, I have the burr angled about 45-degree angle to the enamel surface at a tip of the cuspid. I first start and get myself a nice contour on the facial surface, a nice bevel, And once I have the right shape from the buckle, then I can take away that lingual cusp or that lingual incisal area there that doesn't look real good. So you can see I've shaped that. Now I'm coming away and getting the lingual aspect and just smoothing and polishing that away so that it doesn't interfere with the tooth when it comes down and with occlusion. So we recontour that, and this is what I do. I do that before I place a bracket on there. You can see the other side here. See the cuspid that has kind of a funny shape to it, and we'll just come in and do some contouring to get this shape. Now there's the 45-degree angle. I'm getting my line angle that I want this case to show up, or this tooth to show up in. Get the line angle, and then I come to the lingual and eliminate that extra bulky cusp there. And you can see that's just a nice reshaping. This brings up a point. I always talk to the parents before I reshape a tooth, or talk to the adult and explain what I'm going to do. Never do I just take a handpiece into the mouth. Patients don't like that, and it scares them. So I'm always having this conversation. In fact, this conversation begins at the initial exam where we talk about those pointed cuspids. So that is done first. Once that's done, then we place the brackets. And placing the brackets really has to do with, having the right contours on the teeth. Now there are some times where we have a lower cuspid that is a little bit pointed, so we'll do that at the same time as well. Remember, stall out speed and just being conscious about what we're doing here. So let's get into some really nitty-gritty details about the bracket positioning. And Tom Pitts was a mentor of mine before he moved away from Ormco. And before he did this clinical impressions article I thought was excellent. And it talks about how we can, as practitioners, place the brackets in the same place using landmarks in the posterior. We'll vary the anterior position of the brackets according to Smilark needs, but Tom Pitts came up with this way of placing the brackets according to little contact points between the teeth, and then doing that and repeating that time after time as we position the posterior. So we find and identify the landmarks. You can see these are the contact points, and we're placing brackets according to the contact points. I'll get into that in just a second. We do this on the second molars all the way to the first bicuspid. The cuspids are a little bit different in my hands, and I'll talk about that here in just a second, but here's the contact points, and we're relating the brackets according to that. So the whole idea was many of our bracket placements were keeping the occlusion from coming together, or in other words, the upper molars were hitting the brackets of the lower. So Tom talked about his thinking was, if I place the brackets a little bit more gingival in the lower, then we won't be hitting the brackets with the upper cusp tips. So the molars were placed a slight bit more gingival. Like this first molar would be placed at the contact point, so the top of the pad would be at the contact point. On a snap link, it would be slightly occlusal to that contact point, and that's how we set this case up. Now, the bicuspids would be about a 0.5 millimeter below the contact point, and the cuspid is already shown on here, but what the cuspid is, it's measured at 5 millimeters from the recontoured tip to the slot. And that's how I set my posterior lower up every single time. Okay. Now, then we vary the front for overbite and overcorrection, and we'll talk more about that in a second here. But this is another view of it. Find the contact points, make a line, and then we're placing the brackets accordingly. The pad of the second molar is at the contact point. Remember, the snap link is slightly occlusal to that point, and we're not forgetting about how this is placed mesial distal on the tooth. We want to place it so the edge of the pad of the bracket is right bisecting this mesial buccal cusp, and we can't forget that. So this is also showing how the 6 is placed similar to the 7 in the buccal pit, but also not forgetting about the pad mesial distal. Now when we bond the 4s and 5s, we place the brackets slightly gingival to that contact point. That helps us with our deep bites or our severe curve of spee. It helps us level that curve of spee, but slightly below. And then obviously the cuspid is at 5 millimeters. Now, when we bond cuspids, we imagine the long axis of the tooth, and we don't place the bracket on the long axis. We place the bracket on the height of contour, which is slightly mesial to that long axis. And we don't want to forget about that, because if we don't place it on the height of contour, we're going to get rotations. Now, we'll measure the cuspid to find out what that is. And again, most of the time it's at 5 millimeters. And then we vary the height of the anteriors according to what we need for smile arc and or open bite or deep bite. So if we have a deep bite, we'll place the brackets at about 4 millimeters from the incisal edge. You can see the cuspid's at 5, this is at 4, and that helps us with our deep bite. If we have an open bite, then we'll place these more along lines of 5 or 5.5 millimeters from the incisal edge to help close our open bite. It's that simple. Now, obviously, we're placing the brackets on the height of contour, and we can see where we've missed our bracket placement here. And obviously, that's because of the crowding, but we'll pick that back up once we have our panel repo. The other thing is you can see now this is the lateral. We want to move the bracket slightly mesial to that long axis of the tooth, and that helps us with rotations as well. So we're positioning the brackets in the anterior for smile arc, and it really does come down to this wedge. And we want this wedge to be consistent for a beautiful smile arc. Now, my bracket positioning really depends on each case, and for smile arc and enamel display. But here's the contact points in the top. Let's talk about the top for a second. Remember, the contact points are drawn in with the line. The upper 7 is slightly occlusal to the contact point. The 6 is as well because of that bigger snap link pad. And then what I have done is move the two brackets. This is a little bit different than what Tom Pitts does. Move the two brackets slightly occlusal to the contact point instead of at or above that contact point. I think if you place these 4s and 5s above the contact point, then you run into problems with the cuspid being more gingival and then the centrals and laterals being more gingival, and that's when we get things out of control. And we get bracket placement too gingival. So the cuspid is from that recontoured cuspid to the slot, that's 5 millimeters. And this would be a good example of how we've positioned this. 7 is occlusal to the contact point. 6 is at the contact point, unless it's a snap link. If it's a snap link, then it comes down slightly more occlusal to the contact point. We are at the contact point, at the contact point. Now you notice as we go from the posterior to the anterior, the contact points get more gingival. So one way to check yourself is just look and see if you're showing more enamel as you come forward from the pad to the cusp tip. And you can see that that's what's happened here. Good bracket placement. Again, it's about making that wedge. And then we're going to align the uppers 1 millimeter more gingival than the cuspids for smile arc. So I like to bond the 1s before I bond the 2s. Remember that the 2 is going to be slightly mesial to that long axis and the cuspid as well. So that is bracket positioning. Bracket positioning, again, is the key to finishing. And if you want a great finish, then you need to learn to be a master bracket placement for master finishing.